Hi there! If you're watching this video, you're probably into your first trimester of pregnancy and are thinking about Down syndrome screening. We know that mothers who are preparing to welcome a baby into the world may feel both excited and anxious at the same time, due to the unknowns about their developing baby. The aim of this video is to provide you with information that would be useful in deciding which test for Down syndrome, if any, is best for you. In this video, we will cover the following questions. What is Down syndrome? If I would like to find out if my baby has Down syndrome, what are my options? What are the pros and cons of each option? What are the possible results of these tests and what do they mean? When should I take these tests? After you've watched this video, you will be seen by your doctor to go through any questions you might have. What is Down syndrome? As you may be well aware, we are all made up of microscopic units called cells, and within each cell is stored our DNA, a genetic code and blueprint for our physical makeup. This genetic material is packaged into what is known as chromosomes. When we are born, we inherit 23 chromosomes from each of our parents, giving us characteristics similar to that of our parents. Down syndrome is one of the most common chromosomal disorders and occurs when the baby has an extra copy of chromosome 21, resulting in 3 rather than 2 copies of chromosome 21. This additional genetic material on chromosome 21 results in a range of physical and intellectual abnormalities that one might see in children with Down syndrome. There is no way to predict the severity of intellectual disability in any baby, as this can only be assessed after the baby is born and as the child grows. Down syndrome can occur even if no one in your family has the condition. The chance of having a baby with Down syndrome increases with the mother's age. This is called her background risk. For example, the background risk for a woman at 35 years is 1 in 350. Before we move on to the options available for Down syndrome testing, it is important to know that Down syndrome testing is optional and not compulsory. Some mothers may choose not to test their baby for Down syndrome as they feel that the information gained about the baby before he or she is born will not make a difference to them. On the other hand, some mothers may feel that the knowledge that their baby has Down syndrome may affect their decision to continue the pregnancy, or it may just be so that they can be better prepared for the baby's arrival. Each mother has a right to decide what is appropriate for her, and your doctor is there to guide and support you through whichever decision you make regarding your baby. Thus, in deciding to test your baby for Down syndrome, it will be helpful to think about the following. What is my risk of having a baby with Down syndrome at my age? If the test for Down syndrome involves a small increased risk of miscarriage, would I want to proceed? What would I do with this information? Would I keep the pregnancy if I found out my baby has Down syndrome? There are 2 main ways of determining if your baby has Down syndrome: through diagnostic tests and screening tests. The diagnostic test, or a yes or no test, will give you a definitive answer if your baby has Down syndrome or not. This test involves inserting a needle into the womb to obtain cells from the water around the baby, known as an amniocentesis, or from the placenta, known as chorionic villus sampling. While this test gives a clear answer to the question you're asking about your baby, it carries a small increased risk of miscarriage, which happens in up to 1 in 200 women who undergo the procedure. Cells obtained from the invasive test will be sent for a karyotype, which is a picture of your baby's chromosomes. This test will also be able to tell you whether your baby has an abnormal number of chromosomes other than the one which is associated with Down syndrome, as well as your baby's sex. The other type of test is known as a screening test, the results of which will tell you the chance or a likelihood of your baby having Down syndrome. This is expressed as high risk or low risk. There is no increased risk of miscarriage with these tests, as these tests do not involve putting a needle into the womb. Currently, there are 3 main types of screening tests available. The first type of screening test is called the triple test and is performed in the second trimester from 16 to 18 weeks. It involves the testing of 3 proteins in maternal blood. The ability of this test to tell you accurately that you are at high risk of having a baby with Down syndrome is up to 65%. 2 other methods with higher detection rates have largely replaced the triple test. Both of these tests are performed in the first trimester, allowing you to find out earlier if your baby is at high risk for Down syndrome. The second type of screening test, and which is most widely performed, is called the combined first trimester screen, also known as the OSCA test. The combined first trimester screen is performed when your baby is between 11 to 14 weeks. This test has 2 components. The first is an ultrasound scan of your baby to measure the fluid-filled area at the base of their neck, known as the nuchal translucency. All babies have a fluid-filled area at the back of their neck. The babies who have a thicker nuchal translucency have an increased chance of having a genetic abnormality or a structural problem such as a heart defect. The second component is a blood test to measure 2 pregnancy protein levels. The results from this test, together with your age and the nuchal translucency measured during the scan, are combined to give you a risk score, which is the risk of your baby having Down syndrome. The ability of this test to pick up a baby with Down syndrome if he or she truly has the condition, also known as its detection rate, is up to 90%. This means that if this test is performed in 100 women carrying babies with Down syndrome, it will correctly identify 90 of these women as high risk. However, in 10 of these women, the result will be low risk, despite them carrying babies with Down syndrome. At the same time, 5% of the time, this test will be reported as high risk even if your baby does not have Down syndrome, otherwise known as a false positive result, and may cause unnecessary anxiety. The result of the combined first trimester screen will be reported as a risk. An example of a test result that you might receive is 1 in 1,500. This means that among 1,500 women with results similar to yours, 1 will have a baby with Down syndrome. Generally, a high-risk result is a result which is 1 in 250 or more, and a low-risk result is 1 in 1,000 or less. An intermediate result would be anything between more than 1 in 250 and 1 in 1,000. If the result is high risk, a diagnostic or invasive test will be offered to you to determine with certainty if your baby has Down syndrome. If the result is intermediate risk, NIPS would be recommended. Alternatively, you could also opt to go straight to the invasive test. If the result is low risk, the chance of having a baby with Down syndrome is low. However, it is important to remember that as this is a screening test, low risk does not mean no risk. The third type of screening test, which is increasingly being taken up, is known as non-invasive prenatal screening, NIPS. The NIPS can be performed anytime after 10 weeks, but it would be ideal to take this test at 12 weeks after an ultrasound scan has confirmed that there are no major abnormalities with your baby's structure that would not be picked up on NIPS. This test involves taking a blood sample from you and looking at the DNA in your blood. In pregnancy, we know that about 10% of the DNA in maternal blood comes from the placenta and 90% comes from the mother. The DNA that comes from the placenta has been shown to largely reflect what is happening with the baby and is referred to as cell-free placental DNA. With NIPS, technology is used to sequence the DNA multiple times. In a baby with Down syndrome, increased amount of genetic material above the normal levels is found on chromosome 21. Compared to the combined first trimester screen, NIPS has a higher detection rate of 99%, and only 1 out of 100 women carrying a baby with Down syndrome will have a falsely normal result. NIPS also carries a lower false positive rate of 1% compared to that of 5% for the combined FTS test. In addition to testing for Down syndrome, all screening tests also provide information on 2 other rarer conditions which result from an abnormal number of chromosomes 18 and 13. These are known as Edwards and Patau syndrome. These conditions are associated with multiple abnormalities in the fetus and are mostly fatal. NIPS is also able to tell you your baby's sex accurately in up to 99% of the time. Additionally, NIPS is also able to provide information on your baby's risk of having what is known as sex chromosome aneuploidies, or having an extra or missing copy of X and Y chromosomes. That is, the chromosomes that determine baby's gender. With the current technology, NIPS is also able to screen your baby for other much rarer genetic conditions which fall under the category of microdeletions, such as DiGeorge syndrome or Prader-Willi syndrome, or rare autosomal trisomies. However, due to their rare occurrence, the detection rate for these conditions is low. A high-risk result for these conditions requires careful interpretation, and you would be offered genetic counseling to understand your further options, which include invasive testing. There are 3 possible results that the NIPS could give you: low risk, high risk, and inconclusive. If the NIPS result comes back as high risk for Down syndrome, the chance of your baby actually having Down syndrome is up to 85%. But this number may be higher or lower depending on several factors such as your age and any abnormal ultrasound findings. There are several reasons for a false positive result with NIPS. The first of these is what is known as placental mosaicism, where the cells from the placenta do not accurately represent what is happening with the fetus. Another possible reason is that the genetic material being analyzed actually belongs to a twin that has miscarried very early in the pregnancy, before a scan was performed to detect it. This is also known as a vanishing twin. If the NIPS result comes back as low risk, you can be fairly certain that the chance of your baby having Down syndrome, as well as Edward and Patau syndrome, is very low. However, this does not guarantee your baby will be genetically normal at birth, as the NIPS does not screen for all genetic abnormalities in the baby. About 3% of test results will come back inconclusive, where the information gathered from the genetic material in your blood is unable to give a definitive result. This may be due to insufficient genetic material from the placenta, which occurs more frequently in women with a higher BMI. Another reason the result may be inconclusive is too much genetic material or noise. This may result from a vanishing twin, or very rarely from a maternal condition where there is an excess of genetic material in the blood. In the event of an inconclusive result, your doctor will likely advise you to repeat the test one more time. If the second test is inconclusive again, there is a significantly increased chance that this is because your baby has a genetic abnormality, and an invasive diagnostic test would be recommended. This is a table summarizing the 2 most commonly used screening tests for Down syndrome in Singapore. Please take a moment to review this slide and write down any questions which you might have for your doctor. You will now see your doctor to go through the video you have just watched. Please ask your doctor if you have any questions regarding Down syndrome screening for your baby. Thank you for watching this video. I hope this has helped with understanding your options for Down syndrome screening. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynaecology.